7 deadly cancer signs in seniors. You must never ignore. Are you or a loved one over 60? That nagging cough, unexpected weight loss, or a strange lump might not be just age. What if I told you that catching just one of these signs early could be the difference between life and death? In this video, we reveal the 7 deadly cancer signs in seniors that are often mistaken for normal aging, but may actually be life-threatening warnings. Stay with us until the end for a bonus tip that can dramatically increase the chances of early detection and survival. Why seniors are more at risk. As we age, our risk of developing cancer increases dramatically. In fact, over 60% of cancer diagnoses occur in people aged 65 and older. Why? Weaker immune systems struggle to catch and destroy cancerous cells. Cell mutations accumulate over time. Exposure to carcinogens like tobacco, alcohol, or pollution adds up across decades. Underlying conditions like diabetes or chronic inflammation also create the perfect storm for cancer to thrive. The problem is that cancer in seniors can often be overlooked or dismissed as just part of getting older. That's exactly why you need to know these 7 warning signs. 1. Unexplained weight loss. Losing weight without trying? Sure, it might seem like a good thing, but in seniors, it's often a red flag. Weight loss of more than 10 pounds in 6 months without diet or exercise changes could point to stomach cancer, pancreatic cancer, lung cancer, or even esophageal cancer. Cancer cells demand a lot of energy, and the body starts breaking down muscle and fat to feed them. If your loved one's clothes are getting looser or they're skipping meals due to lack of appetite, it's time to check in. 2. Persistent fatigue. We all slow down with age, but there's a difference between normal tiredness and cancer fatigue. This is deep, bone-deep exhaustion that doesn't improve with rest, comes on, suddenly impacts daily life. Cancers like leukemia, colon cancer, and multiple myeloma often cause extreme fatigue due to internal blood loss, inflammation, or changes in red blood cell production. If grandma needs naps after brushing her teeth, or grandpa struggles to get out of his chair, don't ignore it. 3. Changes in bowel or bladder habits. Going more or less than usual? Seniors often blame bathroom troubles on age or diet, but ongoing changes can signal colorectal cancer. If there's blood in stool, pencil-thin stools, constipation. Bladder cancer, if there's blood in urine or painful urination. Prostate cancer, if there's weak stream, urgency, or dribbling. These signs are often ignored until cancer has already progressed. If bathroom habits change and don't return to normal within a couple of weeks, speak with a doctor. 4. Unusual bleeding or discharge. Any type of unexpected bleeding should raise a red flag. Postmenopausal bleeding could indicate uterine or cervical cancer. Blood in urine could be kidney or bladder cancer. Bloody cough may be a sign of lung cancer. Never assume it's just a minor issue. Bleeding from an unknown source often means that cancer is already damaging tissues or blood vessels. 5. Skin changes. That mole you've had for years, it could be harmless, or it could become deadly. Melanoma and other skin cancers can develop quickly and aggressively in older adults. Watch for the ABCDEs: asymmetry, border irregularity, color changes, diameter over 6 millimeters, evolution or changes over time. Also, look for sores that won't heal, scaly patches, or strange lumps under the skin. Sun damage adds up, even decades later. 6th, difficulty swallowing or persistent indigestion. Swallowing issues or ongoing acid reflux should not be brushed off. These could be signs of esophageal cancer, stomach cancer, or even throat cancer. Pain when eating, regurgitation, or feeling full quickly can all signal tumor growth in the digestive tract. Seniors may avoid eating due to discomfort, which worsens malnutrition and weakens the immune system. 7. Persistent cough or voice changes. Has that cold or cough lasted more than 3 weeks? A persistent cough that doesn't respond to medicine, especially if it's accompanied by hoarseness, chest pain, wheezing, coughing up blood, could be a sign of lung cancer or laryngeal cancer. Don't write it off as allergies or a seasonal bug, especially in seniors with a history of smoking or exposure to chemicals. Why these signs are overlooked? Sadly, many of these symptoms are dismissed as normal aging. Doctors might even wave them off unless you insist on further testing. Here's why these signs go unnoticed. Seniors are less likely to report pain or discomfort. Symptoms develop slowly. Healthcare providers may focus more on managing chronic conditions than screening for cancer. That's why you, as a caregiver, family member, or senior yourself, must be your own advocate. Bonus tip: the 3-step cancer self-check plan. Want to catch cancer early, before it spreads? Follow this easy 3-step check. 1. Monthly self-check routine. Look for lumps, bumps, moles, changes in bathroom habits, appetite, and weight. 2. Track symptoms in a journal. Write down any changes, date, severity, and duration. Bring this to your doctor. 3. Get annual screenings. Ask your doctor about age-specific cancer screenings. Colonoscopy, every 10 years after 50. Mammogram, yearly or biennial after 50. PSA test for prostate cancer. Low-dose CT for lung cancer if at risk. Pap smear and pelvic exams. Power of early detection. Here's the truth: early detection saves lives. Caught early, colon cancer has a 91% survival rate. Breast cancer caught in stage 1, over 99% survival. Even lung cancer has far better outcomes when caught before it spreads. Don't wait until next year. Cancer doesn't wait. It sneaks in quietly, disguises itself as aging, and silently takes over, unless you fight back with awareness. Mental health impact of cancer in seniors. Let's not forget the emotional burden cancer puts on seniors. Anxiety over test results, depression from physical decline, loneliness from feeling like a burden. This stress can weaken the immune system even further. That's why support systems, family, counseling, faith, and community are critical. If your loved one has been diagnosed or is in fear of cancer, be present, ask questions, get involved. Your support could be the light in their darkest hour. The role of nutrition in cancer prevention. What we eat plays a powerful role in either fueling or fighting cancer. Seniors in particular should focus on anti-inflammatory, antioxidant-rich diets. Foods like berries, leafy greens, garlic, turmeric, cruciferous vegetables like broccoli and cauliflower, and fatty fish contain compounds that can protect cells from damage and reduce cancer risk. Limiting processed foods, red meats, sugar, and alcohol can also make a huge difference. Encourage your loved ones to adopt small, consistent changes, like swapping sugary snacks for fruit or using olive oil instead of butter to nourish their body's natural defense systems. Final thoughts. You've just learned the 7 deadliest cancer signs in seniors. Now it's time to act. Don't brush off these symptoms. Don't wait for pain. Don't let fear stop you from seeking help. Cancer is not unbeatable, but silence is. Let's break the silence. Share this video with a parent, grandparent, or friend. It could save a life. Like this video if you learned something new. Comment below which symptom shocked you the most. Subscribe to Diseases War for more eye-opening health content.